Hey, everybody. Welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. Join me as I interview thought leaders, medical doctors, and experts of all types, taking you on your way to optimal performance and longevity. Today's no different. I have brothers, Doctors Lundquist, that I will introduce in just a moment, and our conversation goes deep. And I promise you'll want to listen to the end because it's inspiring and hope-giving to those of you who are suffering. I think you'll really enjoy that. Before I introduce them, I just want to remind you that you can find health products and services at drjillhealth.com. One of our new favorites, especially in the winter months as this is being recorded, is the Rejuvenating Body Lotion. People are loving this product for cellulite and optimal skin. It's got some retinols, really good at clarifying. I literally put this on my arms and legs after my shower. Loving this retinol rejuvenating body lotion, and you can get that at drjillhealth.com. The other big top seller this last month has been the needle-free serum. That is a game changer. I've got it right here. A serum, we only need a couple drops, so this actually lasts a very long time if you get the bottle, and you can put a few drops around your eyes or forehead, and I find it does an incredible job at reducing those fine lines and wrinkles if you're not someone who wants to go and do the injections of neurotoxin, which I'm not a fan of. Okay, so let's get on to our guest. Our guests are Dr. Erik and Davin Lundquist, and I will introduce them here. Dr. Erik Lundquist is the founder and medical director of Temecula Center for Integrative Medicine. He specializes in holistic and integrative care, focusing on endocrine disorders, chronic fatigue, migraines, cardiometabolic issues, and chronic pain. He's a member of the American Holistic Medical Association and the Institute of Functional Medicine. He's board certified in family medicine, subspecializing in integrative medicine, and he is also certified by the American Board of Integrative Holistic Medicine. He's married with 3 children and passionate about empowering patients and educating peers on integrative approaches to chronic disease. His brother, who will also be joining us, Dr. Davin Lundquist, earned his MD from the Keck School of Medicine at USC and has held key leadership roles in Common Spirit Health, including Chief Medical and Administrative Officer, Chief Medical Information Officer for Dignity Health, and most recently served as Chief Medical Officer in an advanced technology-driven improvement in patient care company. With over 25 years in family medicine, he recently has shifted towards functional medicine. You'll hear about his Quantum Advantage method, a science-based holistic framework helping high-performing individuals optimize health and reverse dysfunction, drawing from quantum principles, advanced diagnostic, and targeting lifestyle strategies. His method centers on the 7 core pillars and emphasizes micronutrient optimization to achieve personal wellness. You're going to love this interview. So join me as I talk to Doctors Erik and Davin. Brothers Lundquist, doctors. I don't know how, I mean, obviously people know from your intro who you are, but today we're going to kind of dive deep. And I just want to tell the listeners I've known Davin, you a little less longer than your brother Erik, but both of you for quite a while. And I feel almost like your family in some way, just because I've known you for a while. And again, by nature of your being the brother Davin, I feel like I've known you too. And what I want to say at the beginning is just I have always admired the way that you both work and move in the world, the way you act and design your clinic, your practices, your business of medicine with such integrity. And to me, there's no greater thing that we can bring to the world is just how do we, work, lead, play in the world with alignment. And that's our topic today. But as I always love to start with, its story. So I don't know, maybe we'll have older brother Erik go first. Do you want to tell us a little bit about your journey into medicine and then to where you're at now with this more personalized approach?
Yeah, I'd love to. So I didn't really realize I was going to go into medicine until I was doing an internship in college between my sophomore and junior year at a physical therapy clinic in Las Vegas, of all places. And I remember I was working with this Las Vegas physical therapist, and I was really interested in sports medicine at the time, and really liked the hands-on approach from the physical medicine that was practiced there. But he kept saying over and over again, I wish I was a doctor. I wish I was a doctor. And it just got me thinking. He says, look, if you become a doctor, then you can still do physical medicine. You don't have to be a physical therapist to do physical medicine, but then you're not relying upon referrals. Like you get to kind of call the shots. You get to be that first approach with the patient and decide kind of the journey that you're going to navigate with them versus having to rely on others to make that decision. Then hopefully you get to pick up some of the pieces. And I thought it was really interesting because I had just, I'd only been back from LDS mission for maybe a couple of years. And while I was on my mission, I here I was sharing the gospel, and it was something really important to me. And I was able to meet people and see people who were really struggling in their lives, and really kind of help lift them up and bring them some joy, bring them some hope, bring them some increased faith. But some of their situations from a health standpoint were awful. They either had severe chronic illness or they had some injuries, or even they were born without limbs. And it was really hard to meet with them and help them from a spiritual, mental, emotional standpoint, and really not be able to do much for them from a physical standpoint. So I think that was really kind of where the seeds of medicine started to get planted within me. And then I just kind of got back on my track and what I thought I wanted to do. And that conversation with the physical therapist really kind of pushed me into looking at medicine in a different light. And so then I kind of went on and said, okay, I'm going to be a doctor. And Davin and I, went to undergrad together and shared a undergraduate program also with my wife, Erica. She was in that program. That's where I met her. And it was called kinesiology, but it was really the study of human performance.
Mhm.
And we were getting functional medicine at the time and didn't even know it.
Wow. That makes sense.
I mean, I remember getting our blood drawn, and then we would watch it to see how the triglycerides would float to the top, and then say, all right, I want you guys, they would tell us, I want you to eat the fattiest, highest carbohydrate, richest meal before, and have a big fatty breakfast. And then we're gonna draw your blood and see what
Wow.
happened. So we were already starting to think about it from this standpoint. And we'd have the anatomy physiology classes, and we were thinking about it from this nutrition. And I mean, Eric Sternlicht from UCLA was teaching us about nutrition. So we were like locked in, like, this is what medicine is going to be like. And then we get to medical school and it was like, whoa, this is not what I was expecting. It was very actually discouraging for a little bit. I mean, the first year was okay. You learned about how everything worked in the body, and that was fascinating. And then the second year, you learned about how everything went wrong and what to do to fix it. And what did they give you? A big fat pharmacology
Mhm.
textbook.
Yeah.
And we had to learn and almost memorize all of the drugs that were in there. And I was pretty discouraged. And I went to a American Academy of Family Physicians retreat for residents and medical students at the time. And there happened to be a physician, and unfortunately, I cannot remember his name. He presented a topic on integrative medicine.
Wow.
And I was ready to drop out of medical school. And when I listened to him speak about lifestyle and nutrition and really looking at a patient from a holistic perspective, okay, there's a spot for me. At some point in my career, I'm gonna be doing that. Um, and I was in the Navy at the time. I'd signed up to be in the Navy, and so I had some time that I had to go through and meet my obligations. But once I got out, then that was really my goal, was to really start to pursue that type of a practice. And ultimately, I was able to set up the Temecula Center for Integrative Medicine and have full spectrum functional and integrated medicine with chiropractic care, acupuncture, nutrition, health coaches, nutritional IVs. And it's been a wonderful journey. And I think, my favorite line that I hear from patients is, wow, you gave me hope, or you saved my life, when in reality, I know I didn't. But that's how they feel, because for the first time, they've had a physician listen to what their concerns were, take them seriously, and then do what they could to walk on the journey and help them get healthier. So that's kind of my background in a more Cliff Notes version of what happened to me and how I got into medicine.
Amazing. And a couple themes come that we're going to come back to. But Davin, I want to hear your story. The themes that I hear that I want to talk about is like, how do you really take these vision principles and put them into a practice where we're actually, because we have these ideas, right, of like how we want to be with patients, how we want to spend time with patients, but our system right now, as it is, unfortunately doesn't really allow that. And it's so interesting, the little parallel I heard with you. I grew up with kind of my primary doc being a chiropractor. And I remember him probably 12 years old, teaching me nutrition and saying, Jill, you're too smart to be a chiropractor. And no offense to chiropractors because they're brilliant, but in his way, he was in his 50s, late 50s. He had been persecuted by the AMA and the
Yep.
system. And he was just saying to me, Jill, don't go through what I went through. And again, I have a chiropractor in my office. I have the greatest respect. Like literally, it's why I'm in medicine. So to anyone out there, there's nothing but deep respect in that. But like your physical therapy, it was for me like, oh, wait, I could actually, and I thought about mission work and I thought, okay, well, right now it's easier for an MD to go overseas to do mission work than it is to a chiropractor. So for all those reasons, very similar. And then what's so interesting, I looked at a master's and a doctorate of physical therapy, same thing. And I kept getting the push from these people in my life. Were like, no, 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 you can go into medicine. And the exact same thing was in medical school. I was like, what am I doing here? I don't belong,
Right.
right? But
Right.
as we kept that vision. Now, Davin, I want to switch to you because you've got a totally different experience, although you guys started in the same undergrad. Tell us a little bit about you and how I love hearing your story because you were definitely not in functional medicine from the get-go, but then as you've switched, you've created this whole new way of practicing medicine as well. Tell us your story.
Yeah, I think I mean there are some similarities. Eric and I, people will see that there's a lot of things in common with he and I. We're close in age and we liked a lot of the same things. Both played football together was one thing. But going back when I started college, I was actually a computer engineering major, and part of the reason for that, I just grew up like tinkering with, different computer like programming. And I remember we had at our house one of those IBM PC Juniors. Where
Uh-huh.
it literally had a cartridge that you put in that gave you the programming language, going way back. But about halfway through my first year of college, I also served a mission down in South America. I was in Chile, and there was an experience during that mission that was very medically related, and there was a point in time where I had something going on, some medical condition. It wasn't super serious, but we had a nurse that attended our same church who worked in the clinic there in the little town that we were in, and so she said, "Well, just come by and I'll take care of you." So I remember one day showing up at this clinic, and you know, memory as it serves me. I don't know how accurate this scene is, or if it's become sort of more, uh, artistic in my mind. But it was like it was a super crowded clinic. People everywhere. It seemed like there were animal. They brought their animals, and it was a very
Yeah.
third world kind
Uh-huh.
of clinic. And I remember walking in, and I caught the nurse's eye, and she took me right back to the doctor, and I remember thinking, oh my goodness, like all these people are waiting to see the doctor, and I'm getting this like VIP treatment, like escorted right in. And the reason that that the doctor took me right in was he wanted to practice his English.
Oh,
um, and so we chatted in English for a little bit, and then he took care of me, but that definitely left an impression of sort of the disconnect in terms of like the need versus the number of clinicians that are sort of available to meet that need, and just how many people's lives have been disrupted from a health situation, right? Whether it was big or small.
mhm.
And so that kind of like was sitting in my subconscious as I returned home from my mission. And I finished out the school year as an computer engineering major. And I remember one day sitting in a linear algebra class, staring at matrices on the chalkboard and thinking, what am I doing? It's just like lines of numbers.
Yeah.
And I thought, do I really want to be like the rest of my life, interacting with a machine and numbers, or do I want to be, interacting with humans? And I think like it occurred to me that I'd rather be interacting with humans. And so I shifted gears, and I won't rehash, undergrad. Eric and I had a very similar, ended up at the same school doing kinesiology. And it was, amazing experience. Um, and, on to med school. I did med school in Southern California at USC. Um, the private school tuition said, "Hey, I think I need to join, get a scholarship." And so one day I'm walking through the hallway, and all the armed forces are there, like, sort of
Yeah.
selling their programs to us. And I thought, "Oh, wow, you're going to pay for all of my medical school?
Uh-huh.
That sounds kind of nice."
Yes.
So I signed up for the Navy. And then after, med school, I did a naval residency. And during that time, I mean, this is a little bit of like, circling back to sort of my interests. When I was a resident, we were in a small hospital in Bremerton. And so we had, patients delivered there, but we didn't have like a high risk or a neonatal ICU. And so if patients needed like extra care, or it was a complicated pregnancy, or the baby was at risk, they would have to get transferred down to Tacoma to the Army hospital. And oftentimes we would be on call as residents,
Mhm.
and these patients would show up, and like we couldn't find the chart, or we didn't know the plan, or we didn't have all the right data that we needed to make this decision. And so this is where like my desire to like solve problems for people and systems. I wrote a database to actually track all of the high risk OB patients, so that during, rounds, we would gather the plan from our attendings, and we put it in the database. And that way, when they showed up at night, we knew exactly what needed to happen, regardless of whether we could find that paper chart, back in the day. If only I had thought to market that EMR back then,
Oh,
maybe I would be in a different realm right now. But
you'd be golfing probably.
yeah, probably golfing.
Or-
But it's just kind of fascinating to me how life sometimes, like my initial sort of hobby and interest in computers, that sort of, I share that because what delayed my entry into functional medicine, I believe, was this technology sort of passion. And so as I got into different places in my career, I sort of grew into becoming a CMIO for a large health system. And so I got to sort of use that passion for solving problems with technology in that way. And so I was just starting on that career when I attended a conference with Eric where he gave a talk. It was a very early days, even for him, I think, in the functional medicine space. And I thought, man, this is interesting.
Mm.
And I'd love to learn a little more about it. But this, emerging, technology career was sort of taking off. And so I kind of stayed there and played that out. And so years later, our health system got acquired or merged. It became, so huge, and the bureaucracy of all of it, I sort of became disenchanted with my ability to continue to make, an impactful difference. And so I thought, I'm going to go back to full-time clinical care. And when I did, I spent about a year and a half in like, seeing like 30 patients a day in a traditional primary care setting, and just realizing that this is not the way we're supposed to be practicing medicine. Right about that same time, I was going through some life challenges that caused my life to kind of turn upside down a little bit. And there's some interesting parallels, I think, as I later began to sort of look at the root cause of what was going wrong in my bigger life scenario, and realizing that the same I wanted to do the same thing with people's health, right? Like really help them look at what was causing the issue in their health. And I knew it wasn't the lack of a pharmaceutical drug. So I needed to get out of that system, and I did. So about almost 2 years now, I broke free. I left a very, good uh, traditional job, salaried job, with my health system, to go out on my own and sort of find my way.
Wow. Love your stories. And there's this theme I see, and it's why I love you two both so much. There's number one, there's a real heart for service and like, how do we meet people in their pain and suffering? And what we all found is we can't do that without, for us, without having the physical medicine piece, because you can offer platitudes for someone, but if they're truly suffering in a health related crisis or illness, no amount of platitude is going to fix that. And when we can, even if it's just like Thich Nhat Hanh would say, darling, I'm here for you, right? Like that's the universal thing is we are here
Yep.
in your suffering with you. And I hear that with you. And it touches me so deeply because it's so rare in our world now that physicians still keep that commitment as a leader to sit and say, I'm darling, I'm here with you. I'm here with you. And that is where the healing starts. So that's number one. And I want you guys to comment on that. Number two is my whole thing, and I hear this in both of you guys, it's science and faith. It's left brain and right brain. It's intuition and the judgment of a clinical diagnosis and labs. And to me, you guys epitomize how do we pull these things together? Because so often our training, we all came through this very dogmatic, science, rational based left brain processing, very masculine too, if I can say that. And it's all good because it gave us all a foundation as kind of engineering. I mean, I think of all of you two and myself as well as a bioengineer background. We love to problem solve, and you guys have done it in your practices. But the true leadership alignment comes from this combination of that analytical gift with the sitting with the person and that intuition of the direction to go. So I'm going to let you guys go with that and tell me your experience and how does that fit in with how we lead and be a physician to our patients. Maybe Erik, you can start.
Sure. I mean, that's a great observation, Jill. I think, one of the things that Davin shared that kind of stuck out to me when he said, yeah, when we merged and the bureaucracy got to be too much.
Yes.
I think that for a lot of physicians, it's not just the bureaucracy, it's just the complexity of medicine today. I, I, I mean, I think if you were to sit down and map out all of the tasks involved
Mm-hmm.
in seeing a patient, from the clicking open of the EMR to the, ordering medications to the looking and reviewing of labs to the checking all of the different boxes that you need to check in order to get the documentation correct so that you can submit it to an insurance company and then get paid for what you and then tracking. I mean, it's mind blowing.
Yeah.
But yet, if you sit down with somebody at church or in your community at a park and you're just sitting there listening to them and their story and having a heart to heart, I mean, how many tasks are involved in that? Like none. Like the only task is to focus
Presence.
and have, to be present at that moment. And I think that's what's really lacking. That's one of the root causes of our business of medicine being a shattered mess, right? I mean, it's fractured, it's discombobulated. There's a huge disconnect between physicians and patients. And so it makes it difficult for us to really have that moment with the patients and to connect with them and to say, look, I will walk on this journey with you. Uh, and I think that's what makes integrative and functional medicine unique, stand out, different, because despite all of the complexities that maybe we still work with in my case with insurance-based medicine, I can still take if I take that consciousness and really if it's only for 5 minutes or 2 minutes even, where I'm just putting all that aside and connecting with the patient and having that heart to heart moment with them where I'm willing to say, look, I will walk with you on this journey. Like that's life changing for a patient. So I mean that's I'll answer the first question and then I'll let Davin speak to it, and then we can get around to the second part of the question.
Hey guys, just a quick commercial break to remind you if you have not got my book yet, Unexpected Finding Resilience Through Functional Medicine, Science, and Faith. You can find that at drjillhealth.com if you want your own personal copy signed by me. Just make a note with your purchase and I will personally sign that before sending it off. Of course, you can also get it on Amazon or anywhere you purchase books. And I hope you'll take a look and be inspired and re-energized for your own healing journey. Okay, let's get back to the show. Sounds good, Davin. What comments do you have on that? I want to also highlight you've done some coaching work and some incredible deep work that's very not traditional medicine, right? And you're starting to implement that. Maybe you can discuss a little, because for me, that's so profound in behavioral change and connection with people and, why we do what we do. So tell us just a little bit about that and any thoughts.
Yeah, well, yeah, I appreciate you noticing that about my sort of transition. The first year that I, kind of was broke free, if you will, I still had a part-time job with a tech company, and that tech company, I think, highlights sort of what we're talking about now. This was a company that started out doing remote documentation. And in the early days, before AI, we used Google Glass, which some people may not even know what that is. It kind of came and went. But it was like it was like glasses that were like, it was like a smartphone in a way, and had a camera and a microphone. And so you could wear it like glasses, and it would transmit both audio and video to a scribe who was remote to the location, and then could write your note for you. So as Erik was talking about, like all
Yeah.
those tasks that distract us. In fact, we used to have a saying that, like, just like you don't want distracted drivers, we didn't want distracted doctors.
Wow.
And I think, whether it was the EMR or just all the regulatory requirements or whatever else might be going on, if you have a stressed out, burned out, distracted doctor, then they're not focused on that moment, right? They're not present. And I can't tell you how many, patients would say in kind of the early days of the EMR where they would go to their doctor and the doctor would have their back turned to them, typing into a computer, right? And it sounds so silly, and yet I get it. I get why they were doing that, because in order to just keep up, right?
Yeah.
So I remember describing this scenario of, like, what is it if you distill down to what is the essential job of a physician in a patient's health journey. I think it's that moment of really understanding them and then coming up with a solution of some kind, and it may not be the solution, right? But it's and that's for that problem solving. I think those of us that like to solve problems, right? So it's this marriage of connecting with the human at a level where you truly understand,
Yeah.
like, what it is that that they're feeling, that they're bringing to you, and then sort of merging that with all this data and scientific analysis, and then coming up with a solution. How can you possibly do that
Yeah.
if you're not 100% present,
Mm.
you know? And so and then as I sort of came to understand that, like, no matter how good that solution is, if the person doesn't have the capacity to transform,
Hmm.
to sort of meet that solution and take it forward, you may not get the results that you are hoping for. And so that's where I spent time sort of outside of traditional medicine, learning about personal transformation. And I took a course and got certified as a trainer to help take people through personal transformation, because I felt like that's the marriage, right? Of, like, helping them come up with a solution, and then understanding how to enable them to transform their life. Anyway, that's what
No,
Yeah,
I
they
was
it's
need
gonna
the they need the tools, right? Because a lot of times, okay, here's the solution to your problem. This is what you need, but they would lack the tools. I mean, all of us have experienced this, right? You give the perfect plan to the patient, and they come back 2, 4, 6 weeks later. I just couldn't do it. Like it was too hard of a diet, or I just it was too hard to get from my work to get my labs done, or it was they I can't get to bed early, or I can't give up TV, can't give up Coke, whatever it is. They lack the tools in order to make the transformation. So I love what you said there, Davin, because I think that is a key component of what I think we see in lack of compliance with the plan of action.
Oh, couldn't agree more. And thank you for summarizing, Eric, because I think I can think of two examples off the top of my head based on what you said, Davin. One was a concussion patient who I'm focused on. How do we treat this concussion? They're in their 30s and they were having trouble because it was causing a real disconnect with their relationship because their brain would get overwhelmed. They would get angry outbursts and they were never angry before. And their spouse was like, what is going on? So their concern was, how do I save my marriage while I'm dealing with this severe concussion? And obviously, I was able to elicit that, but I could have been just like, let's just treat the concussion, right? And not take into account their primary concern. And so often when I'm leaving, especially in that first visit, I'm like, what do you really want? Because if it's to kneel on the ground with your grandkids and play with Legos, then I have to, my plan has to accommodate what they really like, what gives them joy, not just maybe, 8 hours of sleep per night or whatever my plan would be. And the second thing was talking about practical application of, I have another patient, all the resources in the world, and he said, I'm having trouble getting my pills together. And I actually gave him a pretty simple plan. He bought a $2,000 machine that will just count and do his pills for him. Not everybody can afford that, but I laughed so hard because I'm like, okay, that's a solution. And it literally was the thing that he couldn't, and it was a pretty simple plan, but he couldn't go, a week and put his pills out. So he bought a machine, which I didn't even know that existed. But talk about these practical things, like those are two things that would not be in the medical plan necessarily. But as we listen and engage and be present with those people, our patients, really listening for those things that really matter to them is the way that we're going to get that change. Um, Gosh, so many places we could go. We did just touch on like left and right brain science, and I don't think we went too deep. Maybe we can talk just a little bit about that. We've danced around it because I think that there's a real thing that we come up against in traditional medicine. It's a very analytical left brain kind of process, just like engineering. And there's an absolute place for that. And again, I see both of you guys as really brilliant left brain cognitive, science-based practitioners. But you also have a deep heart-based place that you come from. And I think that also includes your spirituality and how that shows up. So how do we, as leaders in our practices and in the world, combine those things? Like how do we actually use the science, but not neglect? Because for what I've learned is that little gut feeling is often the most accurate thing when I'm listening. But my medical training taught me that that wasn't valid. So comments on that. Maybe Eric, you can start off again.
I'll let Dav. I don't want to steal all Dav. Davin maybe
Perfect.
have some of the similar thoughts. So I'll
Okay.
let you go first, and I'll
Okay.
fill in the blanks.
um no, I love this. This is to me, being a technology sort of hobbyist. AI is so prevalent right now, and I think that um, where AI will never be, right, is the heart, right, and our ability to sort of have intuition and to have a sense of somebody, and to be able to have that connection at a level, that's different than, hey,
Mhm.
we agree on the data or the metrics, or the algorithmic plan that we've come up with. And so I think, um, even when I was, stuck, if you will, in a traditional primary care model, um, I always felt like, that was something that was so important to me, was that whoever was in front of me was like the only patient, for the day. And because they only allot us, what, 10, I think at one point I had 10-minute appointments.
Oh man.
Um, you know, I was never on time, right? So, but my patients, certainly the ones who had been with me a while, didn't mind when I was, an hour late because they knew when it was their turn, it was their turn. And I would, focus on them until I had a clear understanding of why they were there and what their problem was. And I think oftentimes it wasn't a medical problem, right? Like, it was framed as one. But when you really get in there and start, talking to them, you realize that really they just wanted to talk about stress in their marriage or the fact that they were about to lose their job or who knows, right? What other stress was going on. And, the medical piece was almost just like cover for them because it's hard for humans to be vulnerable, I think. And so that was always a fun part for me was trying to tease out like really why are you here
Yeah.
and how can I understand that? And to your point, Jill, I love that the way you framed it like, well, what is your goal? Like what are you like what is the best case what is the best outcome for you? And I always would describe myself as I'm not the medical police, right? Like I'm not here to like, you know, um, you know, tell you what to do or you're going to get in trouble if you don't follow my, advice. I'm a resource.
Yes.
I want to be a resource for you in helping you achieve, whatever your goals were. And it's amazing how many times all they needed was just somebody to validate whatever was going on in their life. And then, oftentimes the medical part of it was almost like a bonus or,
Mhm.
very insignificant relative to whatever that was that needed to be validated. And so I think that's the piece that I, still to this day, even though, I totally geek out on all the cool
Yeah.
understanding how to, really analyze someone's labs and come up with a very detailed genetics, customized supplement regimen. But at the end of the day, I think that human connection is still my favorite part.
Love that. And Eric, maybe we'll just kind of tag onto that and talk about stress and burnout. It's obviously in our patients. We see it all the time. I think it's at an all-time high for so many reasons. Um, how do we as leaders and how do we, so we can talk to other physicians that are out there, but obviously we have all kinds of listeners from different walks of life. How do we deal with this? How do we align ourselves? What are your tips and tricks for keeping out of that fray of the treadmill and the stress and the burnout, the things that we see all across the board in our colleagues?
Uh, I love that. And that's a multifaceted question that you just asked there. I will do my best to try and hit all the components. I think for me, I'm a very logical person. It has to make sense to me. I think one of the things that bothered me in medical school, bothered me afterwards when I was practicing medicine, is a lot of the conventional medicine approach isn't logical.
Hmm.
It's like, okay, if they have the symptoms, you give a drug. Yeah, but why?
Yeah.
Why, I'm not trying to stop a problem that's just on the surface. Like it doesn't make sense to me. Yeah, I see kind of the pathophysiology connection, but what's deeper, right? What's the root cause of what's happening? And I always struggled with the element of drawing a connection to what the cause of the problem was and just having a solution for the problem, and really more symptom based. So I think for me, one of the wonderful things about integrative and functional medicine that has just been so rewarding has been the answer to the question of why. Why is this happening? Why are you getting a migraine headache? Why are you having these symptoms associated with adrenal exhaustion, right? And I just did a talk on uh, how to interpret adrenal function testing, and it was interesting because there's not a lot of scientific studies out there to support the way that we approach our interpretation of those labs.
Yes.
And I was kind of blown away by that. I thought there would be more out there. And the American College of Endocrinology, basically says no, adrenal insufficiency is strictly these measurements. And there's such a huge range with which you can have serum cortisol and DHEA and pregnenolone and well, they don't even test pregnenolone. What do you need to test pregnenolone for? I mean, it's these kind of things, and let alone doing salivary testing or urine testing, right? So in our approach, we have the ability to take a logical, scientific approach to what is the problem, but then we can actually focus on the heart of the problem, which often is environmental, social,
Mhm.
emotional um, exposures that they're having, right? And then their genetic makeup, their previous potential past traumas, all of these things play a role in the expression of what is happening in their lives. And so I'll sum up what, you know, I've been trying to say here with a recent patient I saw, who super healthy woman comes in. She's in her early 60s, looks like she's in her early 40s. And she wants to know what she can do to try and feel better. And I'm looking at her labs. Her labs are pristine. I mean, she has a cholesterol that anybody would be jealous of. She's not on any medication, and yet she's really struggling. And as we kind of looked into it and I dove into it, I realized that she was really struggling with how to cope with her son,
Mm.
who is an addict and has been in and out of rehab and is currently now in a program. He was 5150 and now he's in a program to try and help him detox. And I we could have done more testing and we talked about some things to help support her HPA access. All of that's good. But what I was really trying to do is get to the heart of the problem. And what I recognized is she was having a hard time letting go of the potential consequences of choices that he could make, right? And I told her, I said, that's not an abnormal feeling, particularly for a mama heart. Like women in general are going to have a higher connection with their children and the choices that they make than dads are. We're kind of like, great, you got out of the house, now go make a man of yourself or a woman of yourself, and we cheer those, and sometimes we're there to even cheer their mistakes and shortcomings because we know that they'll build and grow from that. But from a mama heart, that's just hard to go through. And so just trying, I think, to help her look at it and help her have awareness of how she was approaching the situation. And in doing so, to make sure that she was taking time for herself so that she could rest in recovery. Because she was in fight or flight most of the time in worrying about what the outcome potentially could be. And it just gave us an opportunity to talk about faith. I don't think I've ever used so much biblical scriptures in encounters I did with her. And I know it was because that's just where we were connecting and thoughts were coming to my brain. In fact, I went back and looked at some of those stories. I was like, wow, I'd forgotten all about that
Yeah.
story, but it just was happening right in the moment. And I knew it was what she needed, but I knew it was because we were really connecting, and those stories of faith helped her have some strength and resolve to kind of to move forward. So it was a very powerful interaction for me and for her. But I think now moving forward, she's able to really find some opportunities to make some changes in her life to transform, to Davin's word of the day,
Yeah.
into a higher capacity being that would still allow her to have compassion for her son, but not get wrapped up into his craziness, right? And that's a difficult thing. And I think as physicians, I think sometimes we have so much compassion and empathy for our patients that it's easy for us sometimes to get wound up in their craziness. And we have to separate it. One of the decisions I made a few years ago that's been a lifesaver and a game changer is I stopped working harder than my patient
Yeah. Oh, good.
because it's so easy, particularly once you get into functional medicine. Now you know the whys of everything. There's so much you can do, and you're so excited to tell them. And so you're doing all this work and research and getting them information, and then they don't do it.
Yeah.
Well, you can't work harder than them. So that's been a huge help in my own resiliency, is being able to let go and let them make choices. And when they're ready to show up, I'm there to be their guide, their mentor, their cheerleader, and move them along in their journey. But until they're ready, I'm just going to back off. I'm not going to work harder than they are because that only burns me out
Yeah.
and they're not making any progress. And then they feel kind of that negative energy that I maybe start to get a little resentful that they're not doing what I want them to do.
Mm.
Anyways, there's my thought.
Wow, that's so powerful on so many ways, so many themes,
Yeah.
because the resilience, the recovery, the adaptation, and even the how do we set those boundaries so that we can show up without burning out ourselves? Because you all remember, like in the very beginning, I would go home and I would wake up at 2 a.m. and like, oh my gosh, should I have checked that EKG double check? Like whatever those things in the beginning where we weren't confident in our ability to diagnose and treat. And at least for me, I would wake up frequently at 2 a.m. be like, oh, I got to call this thing or ask about this or call the radiologist because I would want to be so sure that I'm doing the right thing by them. And you can also do that, like you said, in functional medicine, where you're actually carrying that load, wanting them so, you want so bad for their well-being that you take on more than they do. And so that partnership. Now, interesting, and I want to come back to you, Davin, because you kind of set the stage for that, like motivational interviewing and coaching and that. I always think of it as like, um, to the patient, I'm your travel guide, and you tell me the destination you want to go, and then I will help you get there. I'll help you plan the route. I'll help you see the sights along the way. I'll help you pack the right things. So I'm there, but that kind of frames what you said, Erik, because it's not that I'm taking the trip for them. It's not that I'm paying for the trip
Right.
for them,
Yeah.
but I'm
You're not even
there
going
to
to
give
pack their
them.
bags.
Yeah,
I mean,
exactly.
I
And they
think
still
that's
have to
a
do.
lot of times I would pack their bags. It's
Yeah.
like, okay, I'm going to get it all ready for you. I'm doing all these extra things. I'm printing out extra handouts
Yeah.
and I'm
Yeah.
even going and getting the supplement. I mean, like,
Yeah.
wait a minute, stop, stop,
Yeah.
stop. Like
Yeah.
I'm doing too much. I need to let them participate in their journey.
Yeah, so good and so important because I think that showing up without burnout is part of the gift that we give our patients, but we have to make sure that we're not overgiving or overcaring or not setting boundaries. Davin, what have you learned? And again, I love the work that you've done and the learning that you've had in your certification program and everything. What have you learned about resilience? And how does that, not just for our patients, but for us, like what does that really mean? How do we become more resilient?
Well, I mean, if you study, any of the success literature, I think probably the most common thing I heard was those who succeed have resilience. Like that's the number one ingredient, to success because how often do we really know what we're doing, right? Like, we don't become the expert almost until after we've succeeded, right? And so, there's a saying which, and I'm sure there's someone who's attributed with this, but it's just this, I will persist until I succeed, right? And I think it's so important, not only, for us at any stage in our career, I think, right? Because there's different stresses or challenges that we face, regardless of where we're at in that journey. But for our patients as well, I think consistency will always win that health race, right? And I loved what Erik was saying about kind of setting them up. Same with you, like what's the destination? In the coaching world, my mentor Peter Sage would say, you can't make somebody transform. You just have to be the example and the invitation.
Oh, love.
And so I love that, right? Because I think that's the tone that we want to set for people, right? But also, getting back to this concept of, leadership, as physicians, for our patients, right? Not only for our practice, for, for our business, but on an individual basis, the difference between a leader and a manager or a leader and, some other, designation is leaders inspire.
Mm.
And I think for our patients, while yes, we're a guide and yes, we can, lead them to water, if you will. But sometimes they need a little more, right? They need that inspiration that maybe cracks through and opens a little, something that gets them motivated to want to make these changes in their life.
Oh, that's a great place for us to kind of wrap. I'd love to talk at this last few minutes of just inspiration. I love and live for that. I think it's such a worthy goal. And yet I am human, I am fallible. How do we? So say, let's talk directly now. Both you can say a little something to that person out there. They may be a physician, they may be a patient, they may be a mom, they may be any number of places, roles in this world, and they are overwhelmed and they're distressed and they are feeling like there is no hope. What bit of wisdom could we give as we close this episode to inspire that person that there is hope?
You want to go first, Davin? You want me to?
Go ahead.
Well, I think the thought that comes first of all and foremost is there's always hope. There's it's I think the challenge is particularly when we are feeling trapped by our situation is we lack the awareness that we're not trapped.
Mhm.
We may perceive bars around us. We may perceive that we're in a cage, but if we actually check the door, it's open. It's not locked, and we don't have to maintain the same circumstances that we're under. It may be a challenge to get out, and it may be a difficult journey for a little while, but it's going to be scary. I mean, the we're doing a podcast right now and called the Root Cause Business of Medicine podcast, and the theme of that is the first step is the hardest. And I think that's true. Like when you really want to transform, when you want to change, when you want to become something different, that first step is going to be hard, but it's always possible. And sometimes it's just a baby step and you just go little baby step by little baby step. But I think really take a look at your situation and say, all right, if I'm not happy doing what I'm doing, is there anything about what I'm doing that I'm happy about? Or is it just the circumstances I'm in? Or maybe I'm just not cut out for medicine and maybe I need to be doing something different. Maybe I need to be an engineer. But the key thing is really just having that self-evaluation, figuring out what it is that you really want to do, and then moving forward. I realized early on in my primary care practices that I loved being with patients. I loved helping, being motivated by helping them solve their problems, but I didn't like the environment I was in, and I didn't like the system that I was in.
Mhm.
And so I needed to change both of those in order for me to be more in alignment with who I was and how I wanted to practice medicine. And it was super scary. I mean, I didn't know anything about business at the time. I don't have an MBA. I didn't go to business school. Everything I learned was from others or from reading or from just experience. And I made a lot of mistakes along the way. But wow, if I had something to go back and tell, my early medical career self, I would say, hey, hang in there because it's going to get way better and you're going to love what you're
Yeah.
doing. You're going to be super passionate about being a doctor. When people say, oh, I would never choose to be a doctor again, I can't imagine that because I can't imagine myself doing anything different than what I'm doing now. But it took a while to get there.
Yeah. Oh, I love that perspective. Davin, what would you say to inspire the person who's feeling hopeless today?
Well, there's a quote. Um, Two men looked out from prison bars. One saw mud, the other stars.
Mm.
And I think the first step is to help people sort of understand that they have a choice as to sort of which direction they're going to look or how they're going to view their circumstances. And you know, you can be a victim, or you can begin to understand that you control the circumstances of your life. And I think what's so cool about functional medicine and holistic medicine, whole person care, is that you can begin to articulate to people how they can take control of some aspect of their life, right? Maybe not all of it, and they may be overwhelmed, but there's usually one piece, right? One little piece of data maybe that you have that you can say, hey, your vitamin D's low.
Yes.
We're going to give you a supplement that's going to fix that, and it's going to change the way you feel. And then they get that hope, right? It's a small thing, but all of a sudden they're looking up from the mud, and they're seeing maybe one star, and then that gets them going in the right direction.
Wow. I knew this would be amazing. It has far surpassed my expectations. So I love the idea of seeing stars instead of mud, and the first step is the hardest. It's so funny, Erik. I won't go into my personal situation right now, but that's what I needed to hear today. And I hope someone else felt the same way as I did.
Well,
Um,
and there's one thought that
yeah.
Davin shared. So, the late president of our church, who just passed away recently, was a cardiothoracic surgeon and was one of the pioneers in developing the ability to do open heart surgery. But he shared the following quote, which I think is awesome. He said, "The joy in your life has very little to do with the circumstances that you are in, but on the focus of your life." And
Oh,
then because of our faith, he went on to say, and so if your focus is on Jesus Christ, then you will experience joy regardless of your circumstances. And I think that's exactly what you're saying, Davin. It's like when the focus shifts, the circumstances no longer matter.
wow. Gosh, I don't even have any words to end because this has been so touching and good on every level. And like I said, I knew that we would resonate. We'll have to come back for another hour because I want more of the Lundquist brothers. Thank you both for your time today and for the way you move and work in the world and the way you do both inspire. And I know that many of our colleagues would agree. But thanks again for today. Hey guys, I hope you enjoyed that amazing podcast with Davin and his brother Erik Lundquist, both doctors and colleagues and friends. I got so enthralled with the amazing conversation that we had that I forgot to mention their podcast. You will want to be sure and check this out. It's The Root Cause Business of Medicine. The Root Cause Business of Medicine, and I am on their podcast. So if you want to see that episode, you can go to the Root Cause Business of Medicine podcast with Doctors Lundquist and check that out. I hope you'll do that. And for more on their practices, their websites, you'll find that all in the show notes because I didn't get to ask them on the show on live, so I will include all that in the show notes. And if you haven't yet subscribed, please hit the subscribe button and join the over 700,000 subscribers on YouTube. If you're on iTunes or Spotify or anywhere else you listen to podcasts, please do stop by and leave us a review. It helps us reach more people. And I will see you again next week on another episode of Resiliency Radio.